Bismillahirrahmanirrahim. Should we start? It's 9 o'clock. Bismillahirrahmanirrahim.
Go ahead.
Assalamu alaikum, brothers and sisters. Bismillahirrahmanirrahim. Welcome to the live webinar for coronavirus, which is called also COVID-19. It is presented by MCMC Medical Community Physicians, and I have three physicians. But let me introduce myself. My name is Dr. Vimal. I work as a physician specialist in one of the state facility, and I have Dr. Burr, who has about 20 years of experience managing infection control at the state facilities, and he worked as a medical director. We'll be talking about the epidemic, the pandemic, the virus, coronavirus, the spread, and why it is different from the other epidemics. And I have Dr. Mateen, who works with the hospital system, and he is an ER physician, and he will share his experience. I have Dr. Amir Hussain, who is a faculty and assistant professor of medicine in internal medicine residency program, just Seashore University Medical Center, Hackensack Meridian Health System, and he will talk about treatment, how he is managing or his group managing patients in the hospital. So I will invite Dr. Moore. He will talk about the epidemic, overview of the epidemic, the pandemic, the little information about the virus, and then the spread and why it is different from other epidemics. Dr. Moore. Dr. Moore, you there?
السلام عليكم ورحمة الله وبركاته. Can you hear me clearly now?
Yes, I can hear you.
All right. بسم الله الرحمن الرحيم والصلاة والسلام على سيد المرسلين سيدنا محمد صلى الله عليه وسلم. I'm going to briefly, of course, the information about the pandemic is extensive. There is new information on the hourly basis. I'll try to see if we can just have some highlights of this pandemic. So to initiate a discussion, and hopefully we'll have more questions from the community around us asking for further explanation about what we are going to talk about. Now, as everybody knows, it's called the COVID-19, which is the coronavirus disease of 2019, which started in China. It seems to have started from a mutation of the SARS-CoV, which happened in 2002, and this is a mutation of the same virus which has started in bats, and seems to be, after the mutation, seems to have communicated to humans, and the transmission has been since from human to human, not from animals to human. That's very important piece, which means that this virus at present does not have a reservoir in the animals. It's really only between humans. So that's important for a discussion later, maybe in the presentation. And now, how does this virus spread? And like other respiratory viruses, most coronaviruses actually they're usually mild viruses, except the two incidents where there was the SARS in 2002 and the MERS in 2014, which were severe, but other coronaviruses usually cause mild upper respiratory symptoms. However, this virus is, as I indicated earlier, is a mutation of the SARS-CoV, which is CoV-1. Essentially, this is called SARS-CoV-2. And the transmission is through droplets. It's when somebody sneezes or coughs, droplets of droplets of saliva sprays in the air. And it seems that when it sprays in the air, at this time, the evidence showed that it can last about 8 hours in the air. So anybody in the area where this somebody sneezes without covering their face, it seems to be the virus will last for a long period of time. In addition, if it drops on services, it could last up to 24 hours. There was some talk about it lasting even longer, maybe 72 hours, but it seems the evidence now it lasts about, on average, it varies in the kind of service it lands on, but on average about 24 hours. Now, how can we, and of course, what that means, if somebody touches the service where the virus lands, you are going to have that person infected if they end up after touching the surface, touching their eyes or their mouth or their nose. How can we try to prevent? I'm going to go through various steps. How can we prevent the spread of the disease? The first piece is we need to avoid people who are sick if we can. Second, if we are sick, really, we should be staying at home anyway to avoid spreading the disease. And third, if we sneeze or cough, we should cover our sneeze or cough with a tissue or with our elbow. And of course, the most important piece out of this is the frequent hand washing. It seems that most of the communication or spread of this virus comes through contamination through the hands. So frequent hand wash, alcohol hand gel, it seems to be one thing which really it cannot be emphasized enough. And that's very important to keep in mind that the frequent hand what we have to be doing on regular basis. What the symptoms of this disease, the main symptoms which have been emphasized before, which is fever, cough, and shortness of breath. However, more recently, there has been evidence that it also causes conjunctivitis and it causes loss of the sense of smell. So these are new symptoms which we have been documented that they are presentation symptoms for the coronavirus 19, COVID-19. Now, I just want to go briefly about the social isolation. What is the benefit of that? First of all, before I go there, I just want to give you some numbers. I'm sure some of you are aware of these numbers. The total population of the United States. Now, this virus, before I start there, this virus, nobody has immunity to it because it's a new virus. It's called a novel virus, which has not been in existence before. It's a total mutation from previous viruses. Therefore, nobody in the population has any resistance to it or immunity to it. Now, it is estimated that about maybe 40 to 70% of the population would be infected in a virus like that. Knowing that the United States has about 330 million people, if you say about 45 or 50% are going to infect it, you are going to talk about 150 million people infected. Now, about 80% of these 150 million will have mild symptoms. They will not need to be in the hospital. About 20% will be in the hospital. About 5 to 10% will need ventilation. And if you calculate the numbers, you end up about 7.5 million people will need to be on a ventilator. 7.5 million need to be in a ventilator. And the total number of ventilators available in the United States is between 120 to 150,000 ventilators, which means that's only about 1 in 50 to 1 in 40 people who need the ventilator will end in the ventilator. How can you modify that poor outcome, which means that about out of 50 patients who need a ventilator severely infected, you will have 49 die because of lack of support, of course. How can you minimize that is by social isolation, which they are trying to do at present. How does the social isolation work? Is minimizing the spread of the disease. In theory, the incubation period for this disease is about 2 weeks. So if you are able to isolate the population completely for 2 weeks, at the end of the 2 weeks, you will know who is infected and who's not infected. Because if you don't have evidence of infection at the end of 2 weeks, then you are not infected anymore. And then you can keep the people who are infected at home. The rest of the population, they actually function normally. The problem with that, it's impossible to do total isolation for the whole population. Therefore, there is some isolation or social distancing, which we call here. It minimizes the spread. It doesn't prevent it completely. However, if you wait about 8 to 10 weeks, the outcome will mean that the number of infections is slowed down enough that hopefully the healthcare system will be able to support them. So at this time, really, that's the only thing we can do, social distancing. There's a talk about treatment recently. The other piece, if you want, is to increase your immunity, and that means that you need to, main thing you can do is a couple of things. The diet, you increase your vegetable intake, fruit intake, some nuts, some honey, maybe vitamin D and vitamin C. There is evidence that vitamin C actually might improve the immunity. It doesn't necessarily work for this virus, but there is some improvement in the immunity and some exercise. And plenty of fluids and plenty of rest. These are the things to increase your immunity and hopefully fight the illness before it starts. Thank you very much. And if there is any question, we'll answer hopefully later. Thank you.
Um,
I think you are muted, brother Mushtaq.
yes, yes. Yeah. Thank you very much, Dr. Moore. Now I will invite Dr. Mateen for his experience. He is a ER physician, works with the Robert Wood Johnson Hospital System. So, Dr. Mateen.
So I think, given my expertise is in emergency medicine, Bismillah ar-Rahman ar-Rahim, Allahumma salli wa sallam ala Muhammad wa ala alihi wa ashabihi ajma'in, that probably best just to give people an idea of what the ER is looking like nowadays, or the ERs are looking like nowadays, and then how we can help support it in the best possible way. So over the past week, and definitely over the past 2 weeks, there's been a huge change in the type of people that we're seeing in the emergency department. At first, we were seeing mostly influenza type cases, flu, colds, other viral illnesses, gastroenteritis, that kind of stuff. But this has significantly changed over the past week, uh, or 2 weeks now, where ERs are starting to see a very large number of viral pneumonias. It's becoming very common to find people that are coming in short of breath, coughing, fever, in various stages, various symptoms and presentations of what we pretty much assume is coronavirus. The United States has taken despite what the White House has said and other news reports, the United States has taken an approach of not testing everybody, and rather the resources, knowing that they will likely be overwhelmed, we're keeping them for those that are sick. So one thing I'll mention from the perspective of the emergency department is, as we are getting busier and sicker people are coming in and the population is starting to have sicker coronavirus type patients with pneumonias, then we are having to cut back on the other patients that we can really spend time and take care of, who are less emergent. And I will say, thankfully, the public has responded. We are not seeing the same type of smaller cases that we used to before. People are realizing that if you can take care of it at home, you should just take care of it at home. So they're doing that. So let me mention one thing is that if you start having viral illnesses or viral symptoms, for example, a runny nose, cough, congestion, even nausea, vomiting, and diarrhea that present like a cold or a flu, or like a sickness, a virus sickness that you may have picked up from someone, if you can take care of it at home, you should take care of it at home. If you have a fever, take Tylenol. If that doesn't work, you can take Advil, whatever it takes to keep your symptoms under control so that you can stay out of the emergency department. Because if you don't have coronavirus and you come to the emergency department, sit in the waiting room, you may actually pick it up there. So, that being said, what is it that should bring you to the emergency department? The number one thing is going to be if you've got trouble breathing. If you're getting short of breath without doing anything, you're not able to finish a sentence that you start speaking that you would normally be able to finish otherwise, or walking around, you're feeling short of breath, you can't catch your breath, then you'll need to get checked out to see what your oxygen level is, perhaps x-ray, blood work, depending on the situation. But other things like a fever that you can control with Tylenol, cough, runny nose, all the other viral symptoms, if you have some nausea and you can drink a little bit of fluid, or diarrhea and you're able to compensate by drinking fluids, then go ahead and take care of that at home. The primary care physicians have been wonderful, and from what I've seen, that they are taking phone calls from their patients, they're directing them, they're trying to show them how to stay out of the offices, how to stay out of the emergency department. The government itself has set up phone numbers that we discussed in the past. For example, poison control, you can call. It's 1-800-222-1222, and they can help direct you as well. The last thing I'll mention before I hand it over is about testing. One thing that we need to realize about testing is that testing does not really change things in the vast majority of the time. If you come to the emergency department just purely for a test, chances are very high that you will not be tested. You'll just be turned away. Unless you need to be hospitalized or you're very symptomatic or some other cases as well, will test. The vast majority of people will not be tested. And the reason they won't be tested is because whether you're positive or you're negative, if you've got symptoms that are consistent with coronavirus, you are going to be asked to quarantine and stay home regardless. So that being the case, if a positive or a negative test doesn't change the outcome, meaning how we're going to tell you to treat yourself, we're going to save our resources for those people who actually need it. We're actually finding a bunch of people that come wanting to be tested because they think if it's negative, it'll get them back to work. That's not necessarily the case. As I mentioned, if you've got symptoms consistent with coronavirus, we're going to ask you to go home and quarantine anyway. The state has set up, I think, 3 or 4 locations now uh, across the state where you can go to get tested. You can just pull up as a drive-through, get tested, and then they'll tell you results later. That can be done. Some offices, primary care offices, are capable of giving you a prescription to get it done at outpatient labs like Quest, for example. But again, the emphasis is not to get it done because it doesn't change outcome. And number two, don't expect to have it done in the emergency department. Sorry, go ahead.
Yeah, thank you, Dr. Musin. Now, next to Dr. Amir. Dr. Amir, are you in? I don't see your video. Dr. Amir?
Dr. Musa, can I have a few minutes? I had a call from the hospital, just answering, and I'll be back within a few minutes.
I think I have some questions. I just go to the computer.
We can answer some questions in the meantime if you have any.
The question from Mr. Imran Khan. Are cloth masks breeding grounds for pathogens, or can we make them and donate to hospitals?
Well, I could try to answer this if you want. I guess making masks at home and donating to the hospital, we really don't know the quality of these masks. However, if they are the only choice, probably it's worth using. And I know the CDC probably support using anything to cover the face, but only if there is an alternative available, it should be now. If you really you think that you are exposed to a COVID-19 patient, you should be using the N95 respirator. The other mask, although they help a little bit, maybe if it is not, you're not sure, there is no diagnosis of COVID-19 and your involvement with the patient is limited, then you probably can use these masks. Making masks at home and sending them to the hospital, I'm not sure how useful they are. I think that most hospitals now, they have surgical masks, which are probably better than the homemade masks. I'm not sure what the other doctors think about that. But this is what, in where I work, we have been discouraging people from using homemade masks.
Okay. Um,
Dr. Mushtaq,
yes, yes.
this is Dr. Maman. Can I have some few comments?
Yeah, go ahead.
Actually, just want to give you update regarding using Advil or ibuprofen during fever is not recommended anymore because I just had a communication at Harvard and they're suggesting the people who take Advil or ibuprofen for fever. Their pulmonary course was very complicated, and they went to ARDS more than any other people. So if somebody has fever, we suggest that they should take only Tylenol, no ibuprofen, no Advil, because it may make virus some kind of interaction and may cause significant pulmonary issues. And so that's one thing I want to have a comment.
That's very good. Can I pass comment on fever? Actually, this is learned recently too. There are some virology studies which shows actually having the fever is a positive improvement in your immunity. So if you have actually fever and you can tolerate it and don't treat it in general, not only with ibuprofen but with Tylenol as well, your immunity will function better with the higher temperatures, according to recent studies, as compared to if you actually lower the temperature. So somebody can tolerate the fever if it is not causing them to be dehydrated or discomfort, significant discomfort. Is probably not good. It's better for them not to take any antibiotics. Although I am aware there is the evidence about non-steroidals, but the Tylenol too, it although it doesn't have effect of the outcome of the disease, but it actually lowering the temperature in general have a negative impact on the immunity of the person, general immunity of the person. This is something to keep in mind.
I'll add to this as well because I'm the one who brought it up. Is that I've actually looked into this, and there's some thought that NSAIDs or ibuprofen Advil can worsen a cytokine cascade that's thought to occur with ARDS, but it's never been proven. It hasn't borne out in any studies, and so although the WHO actually did put out a tweet on that last week, sometime saying it, that tweet is no longer there, and the recommendation is no longer there as well. So what I've been telling people is take Tylenol as a preference. If that doesn't relieve your fever, and you're still uncomfortable, as Dr. Moore is saying, then at that point, because there's lack of evidence against the use of NSAIDs and Advil as a worsening of this situation, we're just kind of looking at case reports, which is difficult to make of, especially when we see the use of NSAIDs so pervasive in our society, to go ahead and take it. My concern being is if Tylenol doesn't work and your fever is running 103, you don't feel well, rather than showing up to an emergency department purely because of fever control, because if you do, we're going to give you Advil and ibuprofen. You might as well try that at home first.
Okay, Dr. Amir is here. Amir is here. So, Dr. Amir, you can start. He will
Sorry for interruption. Thanks for having this in.
discuss how he's managing the patients with coronavirus in his hospital. Just brief his experience. Go on, Dr. Amir. Are you there, Dr. Amir?
Yes. Bismillahirrahmanirrahim. Thanks for ending this live chat. Just to a couple of things, as Dr. Matin already mentioned, so we are seeing some very diverse clinical picture for this patient, and every day is changing. Clinically, we are seeing a lot of patients coming with this. You already mentioned the shortness of breath and then diarrhea. It's a consistent feature. I'm seeing a lot of I have like 12 patients admitted COVID positive, and almost 8 of them having persistent diarrhea. So clinical picture is every day is changing. Even before they used to say that fever is an prominent symptoms, but I found the 2 patients confirmed positive, and they didn't have any fever. So coming to the treatment, so as already Dr. Moore mentioned earlier, also this is treatment is completely supportive and symptomatic. So we are giving this patient. There's some every hospital have little bit of clinical guidelines they are following. So our hospital also adopt couple of the guidelines. Patients coming with the shortness of breath, then we are and the set starting to give them
Dr. Amir? Your sound system. We cannot hear you.
hydroxychloroquine and even for. But if the patient is not having any shortness of breath, and if he's still having these any the basilar infiltration in the CAT scan or chest X-ray, we are not giving any hydroxychloroquine azithromycin. The evidence is very poor. Only one small study of 26 showed some types of early viral clearance, so that's why they're recommending. But as it's not causing harm, so as a recommendation, most of the hospitals that are saying they're giving hydroxychloroquine. So we are also giving this patient on dish. I have opportunity to dish few patients for last couple of days, three for them, and if they're discharging home, we are giving 2 or 3 days of hydroxychloroquine azithromycin to complete total 5 days. The other part of the diarrhea is just symptomatic management, IV fluid, no antibiotic, and the coming to the fever and of patients. You're seeing a lot of mentioned that NSAIDs and ibuprofen, PSN, and also some of the studies showing that this type of patients is more prone to develop ARDS, so trying to restrict the fluid unless the patients coming with the renal failure and the DKA. Otherwise, you just keep them a little bit dehydration side.
But your
Once
sound echo.
other treatment wise, most of them and some of the patients. Can you hear me right now? Hello?
Yeah, it has some echo, so and some
It's
background
there
noise.
now.
Yeah, better.
Mm. So that's where most of the because as Dr. Moore also mentioned, 80% of the patients has mild symptoms, 14% patients require hospitalization, and 5% critical. We're also seeing this very young patient, 33 years, 37 years, having developed respiratory failure and went to the ICU. It's very unfortunate. In terms of prophylactic, there's a lot of confusion, but in terms of CDC guidelines, there is a no prophylactic benefits of hydroxychloroquine. Then recommending FDA didn't approve any recommendations. A lot of private patients are asking for this hydroxychloroquine prescription, but there's a misconception, and I think also the social media lots of posting that hydroxychloroquine is very effective, but it's not true. And uh, honestly, I'm not personally. I'm using all of the patients with patient had to transfer ICU yesterday, and they were started on hydroxychloroquine azithromycin. No clear benefit of these medications, but this main thing is supportive and symptomatic treatment. In terms of prognostic factor, we don't find any specific clue that which patient might uh, will get better soon. But there's in some studies showing that if the patient has an high LDH, is more than 60 years, and uh, D dimer, elevated D dimer, increase CRP, low lymphocyte count, these are the bad prognostic sign. And we are seeing this is all of the criteria is present in the ICU transfer patient. In terms of profile, the mostly there's also Dr. Moore mentioned that vitamin C is really we're giving all the patients vitamin C, zinc, hydroxychloroquine, and azithromycins. Like this is a bundle I'm giving all of my patients, but I don't know the clear benefit yet. But still patients deteriorating, and this
So,
is still I think most of the physicians have the similar experience that treating this patient.
oh, all right, Dr. Amir. So we'll now start taking the questions. Um, uh, the Sayyid Yusuf Hussain asks, can this coronavirus spread in air for human to human transfer? I think it was mentioned that it's a droplet infection. Anybody wants to come in again?
Yeah, this is usually how it is spread through the air. When somebody sneezes, there are droplets spread around, and usually they spray about 6 feet around the person. That's the usual transmission mode. But also, the other mode of transmission is these droplets, when they land on a surface, they last for about up to 24 hours, where the virus actually survives, and if anybody touches that surface can be infected. But yeah, through the air is a usual communication for it, or transmission for it. Excuse me.
I have next question, Brother Umar Tariq. He, as an EMT, he interacts with many dialysis patients and responds to 911 calls. His work is give surgical mask. So are surgical masks sufficient for protection, or an N95 the only protection?
I'll take this question. I've actually been doing research on this particular topic. So, the CDC guidelines and the World Health Organization guidelines right now for interaction with a patient, COVID suspected or coronavirus suspected. And Omar, I mean, you being an EMT will understand in the situation where you don't expect aerosolization of from their mouth. So you're just there for some non-breathing related complaint. An N95 is preferred, although a surgical mask will do. The N95 is preferred, but a surgical mask can suffice. And that recommendation is based on the fact that we are expecting there to be limited resources, especially with the N95. It's also supported by some a JAMA study done in 2019, where they did a practical study of an N95 versus the use of a surgical mask. So I'm talking about a triple layered surgical mask, the one that you normally find in a hospital. So when the two are compared, the efficacy of the two, meaning practically in the sense of getting the disease, is pretty much the same. A little bit of benefit preference towards the side of the N95, but not enough to be significantly different. This is also borne out in other randomized controlled trials and pooling studies that have been done in the past as well. So in your situation as an EMT, you're going to come across the majority of your patients will not will not have situations that require aerosolized contact, for example, intubation, CPR, that kind of stuff. So for them, if you have an N95 and you can be fitted for it, that is the preferred way. But if you do not, then a surgical mask can suffice. Now, when it comes to aerosolized procedures like intubations, the use of BiPAPs, nebulizers, then for that, an N95 is the way to go. I think you also asked a question coming up about wearing a beard. An N95 is not going to be effective with a beard because of the leak that happens from the N95 not forming a seal on your face. So in that situation, if you're going to be dealing with an aerosolized procedure, then you're going to have to make use of a PAP or hood, uh, and or otherwise hand the procedure off to someone else.
Thank you, Dr. Murthy. There's another question. If someone is a confirmed COVID-19 case, if they recover, at what point do they stop being contagious? I guess anybody wants to answer?
I guess
Yes.
the literature says they can shed the virus up to 37 days. So potentially you can be contagious for 37 days.
Even after they recover from the symptoms.
Yes.
So I have the CDC, as per CDC guideline and our hospital guidelines, they're showing that if the patient is fever free, 3 days, 7 days without any Tylenol or anything, this does count as a patient. And symptoms free at least 3 to 7 days. They're varying from recommendation to recommendation. So, but at least 7 days symptoms free, then they're saying that is non-contagious. They can remove the self quarantine. So our hospital also have similar, and the CDC website also mentioned the similar things, that 3 days fever free without any medications, without Tylenol, without ibuprofen, any remedies. If the patient is fever free and symptoms free, cough or shortness of breath completely free, then they can count as an non-contagious, and they can remove the home quarantine or self-isolation. I just forgot to mention other things that Dr. Matin mentioned, that this is also another important thing. Then this type of patient is not recommending any BiPAP use, and we are also trying to avoid the nebulization of this type of patient. If we use, then we have to use different types of nebulizer for this type of patient, and this increases the chance of spread is any aerosolized procedure. So that's another important point. And honestly, and this patient is not getting benefit from the BiPAP as the other patients we're seeing. That's also another important findings of this type of patient.
So I don't see more questions, but I have a question. It's a general question. Anybody can answer. What are the preventive measures um, to be done to avoid getting this virus infection? What can we do, especially in our society? We going to masjid, visiting families, So how can we, uh, uh, avoid getting, because the as everybody knows, um, the cases are being increasing number gradually. I know it's because of the more availability of the testing. Um, so how can someone, for general community members, how they can uh,
The,
avoid the
I could try to answer that if you want. I think the only way you can avoid to be infected with this virus is probably staying home. If you leave the house and interact with anybody, you potentially can be infected. So you have to keep that in mind. There is no way that a person can completely avoid being exposed to this virus. The reason is because the incubation period is long, and there are people who actually don't show symptoms or they have mild symptoms and carry the virus. How can you avoid being infected? There are a couple of things you can do. First of all, frequent hand washing. Second, avoiding congested areas. Third, staying away from people who are sick. Fourth is actually improving your immunity. How do you improve your immunity? I mentioned that earlier, by improving your diet, exercise, rest enough, and stay hydrated. And maybe taking vitamins. They say maybe vitamin C and D have some effect. But beyond that is really just avoidance. Frequent hand washing if you are out, avoid congested areas, and if you can stay home, the better it will be. That's why the government encourage people to stay home, because that's the only way really to get to avoid being infected. Any interaction with anybody outside the house, or maybe even inside the house, if your family goes in and out, you potentially can be exposed to the virus.
now before I take another question from there's a lot of video available on the YouTube about using a hot air from the hair dryer and inhaling hot steam from the water. Any scientific proof or anything um, anybody can suggest?
No, there isn't. There isn't. In fact, if you have to keep in mind your body temperature is regulated, whether you breathe hot or cold air, or the nostrils might be a little variable, but in general, your body temperature is regulated and it will stay within the range where the virus will survive. The only thing you can get from the air dryer is probably burning your nose. So I would avoid that, especially for people who might not be careful in how they use it. There is no evidence as far as I know. Actually, I did look into that a few days ago because of the rumors around the internet. There is no evidence at all that the temperature has any effect on it.
I'll take um, Shimrez Ali. He is hearing a lot of cardiac arrest because of COVID infection and suggestion how a caregiver can help and deal with such situation. And, uh, I guess they can
Maybe
go ahead.
maybe Dr. Mateen should answer that question. He's in the air. Right?
Yeah, I'll answer that question. Bismillah ar-Rahman ar-Rahim. I mean, it's no different than any other cardiac arrest. So if you're living with a family member who has a cardiac arrest, then you immediately, if you're capable of doing CPR and you're trained, then you go ahead and start that and you direct somebody to call 911. And if you're not trained, ideally get trained. But then if you're not, then you call 911 immediately and they will direct you through the process. So it shouldn't be any different than how it would be outside of COVID season.
No, thank you, Dr. Mateen. I have a next question from Brother Kesar Alam. Do we need to disinfect grocery and online purchases? I guess he wrote purpose, but online purchases.
What's the question again?
Uh, do we need to disinfect grocery and online purchases? I mean, grocery.
Well, ideally you should. I mean, anything coming from outside can be contaminated because the virus can live on services. Is it practical? I'm not sure. But listen, I think ultimately we can, unless you live in a bubble, you really are not going to avoid to be 100% sure that you have not been exposed. We have to hope that, remember again, and that is all the statistics shows that up to 80% of the population, they say 40 to 70, maybe 80% of the population is going to be infected anyway. So that's unless we develop a vaccine before it goes through everybody. So the likelihood that most of us will be infected, hopefully, we will have a mild infection. That's the hope that we'll have mild infection. It will not be affecting our health significantly. It will be like a common cold and will pass through, like 80% of the people go through this. But to say that you will, I mean, I'm sure all of us go through this. If you go to the hospital and you open a doorknob, you never know how many people opened it. You go to the bathroom, you touch the faucet. Wherever you go, you are likely that you are touching a place where somebody who is infected has touched. Now, and therefore, the only thing you can do is frequently wash your hands. Disinfecting everything coming to the house, it makes a lot of sense there. I mean, somebody sent a link where if you come to the house, you have to be sort of decontaminated completely, where you take your clothes, your shoes, your hair, your everything away before you enter the house. Is that really practical? Of course, it's not. So the reality is, most of us will be exposed. Hopefully, it will be a mild disease, unless you don't go outside the house. If you are able to stay indoors, the longer you stay indoors, the less likely you will be infected. Now, it doesn't mean that unless the virus. Let me just mention something about this virus, actually. And again, this is my discussion with recently with other infectious disease doctors. Since this virus does not have natural reservoir. It's a mutated virus. It doesn't have animals which carry the virus, for example. You're likely if you can if we are able or if the community at large or all the countries are able to control the virus for 2 weeks, in theory, this virus will disappear because there is no natural reservoir for it. Problem is, how can you do that with people who are socially, I mean, the humans are social beings. They want to interact with each other, and therefore they will continue to communicate the virus, and it probably is going to be endemic. So at some point, we probably will be infected. The issue is we really need to slow down the infection rate so the healthcare system doesn't get overloaded. That's the best hope we have for this virus.
Thank you, Dr. Moore. I have next question. Brother Umar Tariq is asking, Gargling salt water and drinking hard liquids like tea every day recommended for healthcare workers to clear out pathogens in the throat? Or are those methods common myths?
It's been addressed already. Dr. Moore spoke about it.
Yeah. All right. Next question. Um, what has to be done if we find out we had exposed to positive COVID patients? Do we have to check the temperature twice a day, or what are the other measures we have to watch for?
So the answer depends on who you are. If you're a healthcare worker and you have people that you take care of, for example, at work, a nurse, a technician, a physician, and you become exposed, then you should be keeping an eye on yourself. For example, in the hospital now, our hospital has instituted a policy that you temp in when you come to work. So you come to work and you get your temperature done. And ideally, you do it at home as well, just to keep an eye on yourself, so that if you start showing symptoms, then you stay out of work. But for the average person who is not in that situation, then there's really no need to do anything different. You don't need to check your temperatures. If you feel okay, you feel okay. If you start having mild symptoms, then you have mild symptoms. And as I explained earlier, that as long as you're not having trouble breathing or there's some other cause that would normally bring you to the emergency department, then there's no reason to take these measures of constantly checking your temperature or your symptoms. For most people, it'll just increase their anxiety and it won't cause any changes in how they live their life or what they would do otherwise.
Okay, and I have last question. Actually, second last. Brother Sadal is asking currently we have in New Jersey cases are doubling every 3 days, up to 6,800 as of yesterday. How long does this continue? Is this what happened in Italy and Spain and China?
I could try to answer this. Dr. Amir, you want to answer it? Maybe that because he did not answer any of the. You want to answer?
That's okay. You can answer it.
Okay. So this will continue as unless you have a total social distancing. The rate will continue to go this way. I'm not sure about until Italy actually they did the strict social distancing. They continue to have the same rate of infections, about doubles to triples every couple of days, and that's going to be the case here. Hopefully, unless there is distancing, social distancing, and hopefully this social distancing will continue for a couple of weeks. That will slow it down. Unless you do social distancing, the rate will remain the same. But here in New York and New Jersey, I think they have, and some other states, they implemented the social distancing, and that's the only effective way to slow the rate of the infection. Because once you are mixing with a lot of people, you are likely to get the infection anyway. And the only way to slow it down is by being away, being staying at home, like most people are doing now in New Jersey and New York and California and other states. So the rate will come down over the next couple of days, couple of weeks. It will come down, and then hopefully, when people start going out, the rate of infection will not be as fast because there will be some initial stage of herd immunity. Now, to have a herd immunity, you have to have about 70 to 80%, actually 60 to 80% of the population either vaccinated or have been exposed to the illness. We will not have that number, but there will be some interruption in the chain of the transmission after 3 4 weeks of social isolation. So it will slow down if they continue to do the social isolation. That's the short answer to it. If there is no social isolation, the rate will continue until about 80% of the people has been infected. And that's the danger of not doing the social isolation. Makes sense?
Yeah, no, it does. Thank you, Doctor. I have a question from Doctor Brother Hashmi. Question for Dr. Khalil Mehman. Do diabetic or cardiac patients have a higher risk of getting the virus and worse effects on them?
Actually, the diabetic people and hypertension definitely has high risk of getting infection. So recommendation they should follow all the guidelines. They should take their medicine very regularly and strictly because I was reading some literature. Some people, if they stop their statin, they may do worse and they have a high chance of getting ARDS. So they should discuss with their primary cardiologists or doctors and make sure they take their medicine faithfully, very regularly, strictly. I see a lot of our community people who come to my office and they stop some of the medicine by themselves and they don't want to take them. So I think that's another thing we have to educate our community, especially our community, because they want to treat themselves a lot of time. They feel they are taking too much medicine, so they stop this medicine, that medicine. So that's not correct actually, and because they are more prone to get severe heart failure, and especially old people when they get sick. About I think roughly I can say about 7% get very critical. And out of that 7%, 22 to 25% get myocardial injury, and, if you check their troponin will be high, and they will be going to heart failure and cardiogenic shock. So I strongly recommend control blood pressure, continue to take your statin, and follow strict guidelines.
I just want to add some points, and some of the studies show that hypertension patients with hypertension is a high mortality rate, even 16%. So this is the most very common association of disease, the bad prognosis. And the other things I'm getting also called from a couple of my patients. I think Dr. Manon also getting this call. There's a ACE inhibitors, low certain, and listen, a pretty lot of patients has a rumor going on, and they're asking me, then should we stop this low certain or lisinopril? But as a clear evidence, there is no proven study, and there's no correlation with this bad prognosis and with these medications. So to make sure.
Yeah, if you go to American College of website, they already published data that ACE inhibitors should not be stopped. There's no definite evidence. So we should
Yes.
keep continue, and we should not tell patient to stop ACE inhibitor. There is no evidence right now.
Right. No ACE inhibitors, even low certain also out of patients calling. So no, don't stop these medications. There is
That's right.
no
Yeah.
clear association.
So control blood pressure and take your statin, control your diabetes. That's very important for the older people. And and one of the study also suggests the people who qualify to take a statin, like diabetic and all those people, and if they come with pneumonia or something, you may start the new statin also on those patients because there is some benefit with the statin also in acute respiratory failure. Or so if they qualify, they have because suppose they're very hyperlipidemic and they have diabetes and they're not taking statin before, then you should put them also on a statin.
Yeah, I just want to clarify for the community, statins are the cholesterol medicines, lipid lowering agents. Uh,
Let me just add one point, just real quick. Actually, I just want to say that the receptor for this enzyme is actually the ACE2, in case somebody wants to know, and that's why they are talking about ACE inhibitors as being having bad prognosis. The second piece, although the two major organs which usually fail is the lungs and the kidney, but the virus has been found in almost all tissues, and the third most common area where the virus is found is actually the heart and then the skeletal muscles. So the virus actually spreads around different areas and affects different organs at the same time, not only the lungs. I just wanted to add that piece there. Thank you.
thank, thank you, Dr. Amir. I have a question from Brother Mujib Khan. I think we have about 6 more minutes to go. How do we differentiate between regular flu and COVID-19 because of the current allergies, the pollen, etc. going on now? Dr. Amir, you want to answer?
Mm, yes, I want to just mention a couple of things. I think um, one thing is most of the time we're seeing these runny nose, sneezing. These are the not common symptoms in COVID patients, and rarely I'm seeing this type of patient. most differentiating factor with this flu and this COVID virus is this the shortness of breath. In normal flu, we don't see too much shortness of breath, and then non-productive cough. Uh, is differentiating factor. Fever also, but I'm seeing also patient without fever, only the GI symptom in which this became positive COVID. So the most striking is also having the other non-specific symptoms is very peculiar about this virus. Dr. Moore already mentioned the loss of the smell, uh, fatigue. There's the common flu. Usually, the most striking factor is the flu is a high fever associated with the myalgia, runny nose, sneezing, and these symptoms are not very common with this COVID patient. Although the fever is the things, shortness of breath, dry cough, and these are the things. And yeah, that's why I mentioned this runny nose and sneezing is not so common. But now saying this red eye can be, but I'm not seeing this too much patient. I didn't see any one of my patients with these whole symptoms, runny nose, sneezing. I didn't find them. These are the most common things in. And Dr. Martin wants to add anything else? If because you are seeing a lot of patients in the ER.
Yeah, no, I think what you're seeing is about what I'm seeing. I don't think there's not more to add than what you said. Jazakallah khair.
So I have question from Azina. They want clarification. What is social distancing? Is it 1 meter or 6 feet?
Both are okay.
Now, Dr. Moore, there's a new term I mentioned in the WhatsApp group. They're saying physical distancing, like it's not social anymore. It's physical. Like you have to be 6 feet away from the person. Uh, so the next question is, I don't know who at MCMC, and if somebody has a thyroid condition, is it more susceptible to COVID-19?
No evidence to that. I don't think I did not hear of any, but I don't know about the other physicians, but I don't think there is evidence to support either way. There is no evidence that there is high susceptibility to the virus because of thyroid disease.
Yeah, I agree. I haven't heard anything about thyroid. Um, so we have about 3 minutes. The Mohammed Ali Hashmi is asking how they are handling COVID bodies in hospital and handling over to the funeral homes. If anybody can answer. Um, I think because of the infection of the virus, they have to be very careful. Uh, if anybody else has another answer, but I'll just mention, as far as my knowledge, they have to handle the bodies very carefully because they are very contagious. Um, protect the body from to get infect other people. I'm sure they have a strict procedure and protocol, like any other person who has an infection. Anybody want to answer add to that?
Well, see, since I mean the body itself will probably have the virus, so if you don't directly handle the body, you should not be affected by the virus. But since the person is not breathing or coughing or sneezing, you're not going to be exposed to spraying the virus onto you from the body. So essentially, if the body is covered and you are not handling it directly, you should be okay. Now, what you really need to worry about when we talk about Muslim janaza is the ghusl, for example. When you do the ghusl, you're likely to be exposed, and if you are going to do such a thing, you really have to be very completely sort of dressed in a way like wearing the gown, gloves, goggles, and a mask to make maybe even the N95 mask because of the potential spray of water around the body. That's what you need to worry about. But how the hospital handles the patient, I don't think it should be a big deal once the patient is covered with sheets. It should be okay.
Can I have a comment?
Go ahead, doctor.
And I just want to suppose you delay Gusal for say 8 to 12 hours. Does will help? because the
Well,
virus
maybe
may
you
die.
should be probably you're talking about at least 24 hours, maybe 72 hours. I mean, if you really want to be completely safe, the delay should be 72 hours.
Yeah.
Anything less than that, there is debatable. I mean, what they're saying at this time, it's about 24 hours, but only a week or two ago, they were talking about potential 72 hours. So these numbers can vary from one day to day, and to potentially you probably will be exposed regardless unless it is more than 72 hours. And even then, you really need to make sure you use personal protective equipment when you are handling the body anyway.
I think we are over time. There's one more question. I think it's a public health question. Anybody wants to answer? Spraying public places to disinfect would help, as we all know, many countries are doing it. Will US still be doing it as well?
What's the question again?
Spraying public places to disinfect would help. The
Spraying public places.
they're showing on the TV or YouTube that many countries are spraying in the streets and
Yeah.
roads, and I think that
I'm not sure what they're spraying because unless they spray the patients, it doesn't make any difference. And they have to spray the patient inside as well. So I don't think it doesn't make any difference, really.
okay. Thank you very much. We are
I
ending.
have just a last comment, if I just 1 minute. As a private doctor, I've been receiving a lot of calls from the patients pre-prophylaxis, post-exposure prophylaxis, asking for this azithromycin infusion or hydroxychloroquine. So just to make it clear, there is no proven benefit, no study showed any difference, and it's not preventive to pre or post exposure prophylaxis for any medication. So just to clarify, a lot of patients have become panicking and calling the doctor's office having prescription for azithromycin or hydroxychloroquine. So it's not recommended, and there is no proven benefit for this. Just to make it clear.
I think it's still in the research, and still time will tell what medicine will help. It's
Right.
early to say anything will help.
Recently, one patient died by taking this medicine
Right.
because of long QT interval, because both chloroquine and zithromax can
Right.
cause
Both
prolonged
are can cause.
QT, and
That's
patient
true.
can have a sudden death. So unless you had EKG done and make sure the EKG is normal, and then you want to take this prophylaxis, then we can think about, but not randomly.
Mhm.
Just to mention, the QTC means it can block the heart. It can abnormal heart rhythm and can block the heart. So that's why it's a very risky medications also. The patient's taking multiple medications. It's a hydroxychloroquine and azithromycin is not safe for any cardiac patients. So just to clarify, they can have a heart block and they can die from that.
So basically, they should consult with the doctor full recommendation,
Definitely, yes.
not take any medicine by themselves without recommendation. Okay. Jazakallah khair, everybody. Thank you, Dr. Noor, Dr. Mateen, Dr. Khalil Mehman, Dr. Amir, for your suggestions, advices, and informative session. So we'll end the session, inshallah. If needed, we will meet again and update the community in the future.
Assalamu alaikum.
السلام عليكم
Jazakallah.
ورحمة الله
Assalamu alaikum.
وبركاته.
Assalamu alaikum. Assalamu alaikum.
Mm.